Hey, if you're like me, you have a labor ball or a birth ball at home, but you're not really sure how to use it the best in pregnancy? Or are you a labor nurse or doula and you just want a ton of ideas about how to use a birth ball correctly for your patients and your clients? Great, stick around. This is the tutorial for you. Hi, I'm Mandy. I'm a labor and delivery nurse. I'm here in my hospital and I want to tell you my favorite positions for a birth ball. Also, did you know that they come in sizes and that you should be using the right size so that you don't get hurt? Yeah, I'll tell you about how to size them too. I believe that women's bodies are powerful and with the right support, we are unstoppable. If you agree, thank you so much for the likes. Stick around and consider subscribing. Also, do you know anyone who's pregnant? Share this video with them. These are my best kept secrets, but they don't have to be secrets. Will your labor nurse know about these birth ball positions? I don't know, but you can just pull this up on your phone and show her. Okay, let's not waste any more time. I want you to get these birth ball positions and start practicing. So get out some paper if you need it and definitely stick around till the end. It's my favorite position, possibly in labor, that I'm gonna share with you. Hey, did you know that there are multiple sizes of birth balls? I have 3 today, and this is Meredith, who is my friend who's gonna help show you how to size a birth ball. Also, so Meredith is not a nurse. She is my pregnant friend, and she has actually never been in a labor room before, so I'm really excited that she's here with me, helping me on this video today. I wanted to show you what I'm showing her to help get her positioned for this video to teach you. These are charts. They're photographs of positions, labor positions, and Premier Birth Tools makes these and sells these on their website at premierbirthtools.com. They're awesome, and this is what I'm using to help show her what I'm talking about when I'm positioning her. I also use them for my patients and in my Lamaze class. These are the 3 sizes: 55 centimeters, 65 centimeters, and 75 centimeters. I'm 5'7"-ish, so the 75 centimeter ball fits me, but let me show you why the 65 centimeter ball fits Meredith. First of all, she says that it's comfortable, right?
Yes.
Okay. Also, your hips and your knee are at a 90-degree angle when your ankle is at a 90-degree angle. Okay, so your feet are flat, and this is actually a really good size for you. I bet you could also go up if you were comfortable on the bigger size, but I would not go any smaller because your hips would be sitting too low. And the idea is that your hips are up either over your knee or at the level of your knee. Can you see the angle of her hips, her knees, and her ankles? That is why the 65 centimeter ball is a good size for Meredith. And this bad boy is the large size. It's great for people who are 5'7" and taller. So her size is 65 centimeters. It's the medium. It's the most popular. It's for 5 foot to 5'7". And then the small one, I rarely ever use it, really, but it's for people 5 feet and under, 5 feet and shorter. This is my prego friend, Lindsay.
Hi.
She's 32 weeks and she's 5 feet tall. And I have put her on the small the small birth ball. So you can see how this ball fits her so well because her hips and her knees are at a right angle and her ankles. It's uncommon. I don't have a lot of patients who like this size, but she sat right on it and loved it. Meredith is in one of my favorite positions for the birth ball. She is leaning over it, knees on the floor. Her knees are wide and the ball moves. So my favorite part is that I have access to her back and she's able to control her motion and her rhythm. So you can rock your hips, back, yeah, or side to side, or just your hips. There. So Meredith was just telling me about her back pain. So a great exercise for this ball that you can do even now when you're pregnant at home, hint, hint, is cat-cow. And this is a good position for it.
You can use your hands and knees on the floor, but this is comfortable. So you would arch your back for cat. Yeah, you can curl it for cat, and then rest it for cow. Back and forth. Yep. And this is going to change the shape of your pelvis and keep those ligaments loose. Does it feel good? Mm-hmm. Good. When I stand up, this is going to cut my head off, but this is an abdominal lift while Lindsay's sitting on a birth ball. All right, so you can rock, and I can rock with you. So this lift is going to help lift Lindsay's belly, which is going to help back pain, help alleviate back pain. Does that help?
Yeah.
It feels good. I'm applying steady pressure, but I'm also trying to move with her. And I'm just pulling up just a little bit. So this position is an abdominal lift in a hands and knees position on the ball, which is great because this is easy for me. I can stand where it's comfortable. She can move on the ball, and she can also move her hips and keep her hips wide. So this is an asymmetric side lunge. I like it, but I don't often use it, and I don't often see people using it. Meredith says that it's a good stretch on her pelvis, which is awesome, in pregnancy especially. And in labor, this is an advanced move for back pain and for the baby who's in a sunny side up position. Okay, good. Okay, this is an asymmetric position for back pain. And a lot of times that comes with an OP presentation of the baby. So Meredith is able to kick her knee up, but it doesn't extend over her toe, and her other foot is firmly on the ground. She's leaning over the ball if she wants to, or she can stand straight up depending on how her contractions feel. And she's not contracting right now, but she's able to still move and rock. I would suggest staying on the side that feels comfortable to you, shifting if you can. So a few contractions like this, go to the other side of the bed or take a pee break, then go to the other side of the bed and switch your leg up. So we were just talking about why this is important. It's important to give your baby as much space as possible for her or him to find the route out.
Get out of here.
Keeping those ligaments loose is important. That's why we're moving, and that's why we're switching side to side. And shifting your pelvis, even just a little bit, even just this amount, is going to help shift the baby to find the best position out. So head down, facing down. Okay, we are back on the birth ball. We're back on the birth ball, but we're in the bed. How many labor nurses, how many of your patients have to stay in the bed? A lot. Or if you're tired of being on your knees on the floor or in the tub, you can get in the bed, kind of have more relaxed space and more cushion for your knees. So she is on the birth ball, but there's space for her belly right here, and I've lowered the bottom of the bed just a little bit. So she's able to rock, and I would say knees really wide right here. This is actually a good push position. If you were to lean back on your knees backwards, yeah, it's like a squatting position for pushing. A lot of people feel really comfortable with that. And then you can rest in between, because in between contractions, maybe that's a lot of strain on your legs or they get tired, you'd rest back up in this position. You can rest. So Lindsay is in a thrown position in the bed. I've dropped the bottom of the bed down as low as it'll go. And I've raised the back of the bed just for fun because her back isn't even touching. This can be done with someone who has an epidural or someone who just wants to rest and be somewhere where they can rest. This is a great restful position. What I tell my patients is it's gonna be weird, but get in the position and then tell me how you feel. So you're not even there yet.
All right.
Okay, so take your feet and they're gonna go even wider around the ball. This is a medium-sized ball, and for a lot of people I even use the large ball, which makes them like, what are you doing to me? But the goal is your ear is gonna be on the ball. So you're gonna lean, yep, you're gonna scoot to the end and lean forward. If she could not get to that position, I'm gonna help her by having her partner on one side, and they and me are going to actually just lift this straight in the air, and it moved you forward. So it tilts your pelvis forward so that you can actually hit the ball with your ear. And it's pretty intense. I've seen this position help turn babies so that they face the floor. I've seen it help with descent into the pelvis, like laboring down. Actually, you said that you were in a position enthroned, right?
Yeah.
While you labor down to help the baby move down into the pelvis. So I've just helped a woman position like this. Here I am charting, and half an hour later they say, I feel pressure. So it's really good for that rest period. So she's able to rest on here. Of course, someone's going to be with her. I do not want her getting out of this position by herself, but I've seen people sleep like this, wake up, push, and have a baby. So it's a really good position for a lot of things. This is my favorite secret position. Oh, another reason I love it, it helps with decelerations in baby. So if the baby is having heart rate decels, sometimes it's a harder position to get into, but once we get you there, the baby, for whatever reason, turns and gets off the cord, and she can continue to labor. So it's really great to keep you pregnant and keep you in labor if we're watching the baby's heart rate. Oh, you can also take these in the water. I love helping a woman labor in the shower, sitting on the ball. You can take the shower head in, direct it onto your belly or onto your back, and then you're able to move. So there is research out there about birth balls, yes, and using them in labor can reduce pain, increase a woman's satisfaction with her birth, and her satisfaction with the support or the feeling of support that she felt from her partner. So it's awesome to use a birth ball in labor. I used it in both of my labors and all during my pregnancy. I loved it. Most hospitals have birth balls that you can use while you're there, but is your hospital using the best? The balls that I'm using today are made by Aeromat. They are top of the line, burst resistant and latex free. If you're not using these, why do you even have them, right? Because these are safe. That's the most important part. They are not gonna pop, and they're gonna last a long time. They're very sturdy. I mean, they're really like no other labor or birth ball that I've ever used. I just blew these up yesterday. They're a little funky, like this right here, but they're good. This video was my idea. I am so passionate about sharing what's worked for me as a labor nurse with you to help your labor go easier, smoother, and faster. But Premier Birth Tools contacted me. They wanted to make it easier for me to record these videos for you, so they sent me these 3 labor balls. They also sent me this awesome position chart. Okay, we already have these charts in my hospital. We use them on our unit because they're amazing. They're laminated, they're gonna last forever. They give me lots of ideas. Thank you so much for watching. Hope you learned a ton about birth balls. Please let me know your favorite birth ball position below, and if you learned of a new one, I'd love to hear your feedback after you try it out. Also, thank you to Premier Birth Tools for these awesome balls. You can find a lot of these products that I used in this video at premierbirthtools.com, and there's gonna be a discount for you by letting them know that you heard about them from me. So down below, I've put the discount code. I've also put their website to make it easier to find. The question is, do you give birth with balls? Oh, look how bright I am. Definitely comment below. I want to know your favorite birth ball position.